We received this press release regarding sort of the stats that have been a report that's been carried out really about how social workers have coped during the pandemic. For my sort of knowledge, can you just tell me what the main purpose of this report was, and did you realise sort of that the stats and findings would be so sort of dire and stark?
Yeah, well, the actual stats were no real surprise to us at the Social Workers Union. We've been doing research for the last 3 years looking at the pressures on social work. But quite interestingly, the figures were probably a lot higher than we expected. And really, it's been a difficult time for social workers over the recent period. And really, this short survey, we were really surprised to get such a high response. And that really indicates the feelings with social workers. And I can maybe talk about some of the findings if you've got any questions around that.
PPE, that was a huge issue for all of the majority of health workers in the UK. The government was criticised a lot. In terms of social workers, over half in the West Midlands have been provided with inadequate. Can you talk me through a bit about that, please?
Yeah, just looking at individual responses from the West Midlands, there was certainly issues at the very start. I think that was the case in sort of most professions, really. But social workers were further down in the list, because ultimately the health professionals came in first. And over that time, we had some of our members really, going into families' homes for child protection, safeguarding measures without any protection, not even able to wash their hands. They were carrying flasks in their cars and makeshift scarves. So initially it was a difficult time. So moving on, the protection is there, but what we're hearing from a lot of members is it's still not adequate. It's still not, the full sort of measures you would expect, and that changes all over the West Midlands. So ultimately, it's been a difficult time, and I think I should add really that over this recent crisis, there's been 21 official deaths from social workers in the front line as part of the job role, and that's from government stats. So my thoughts go out to all the social workers it's been affected in that way.
Sure. Sort of looking at this and looking at some of the other stats where they feel like they've put their own health at risk and they felt threatened with disciplinary measures for raising safety concerns, do you think that social workers have been sort of forgotten about during the pandemic, despite providing this essential work to keep people safe, which is the irony there,
Yeah, well, I would agree with that, and I think if we all reflect, including your own listeners, if you think of the word social workers, that wasn't used a lot during the recent events. There was a clap for the carers, a clap for everyone else, and albeit social work was a frontline service, we were way down in the pecking order. So ultimately, it was about having respect for social workers. I think the problem is a lot of the public don't really know our role. They see us as maybe going into families' homes and taking away children, but the reality is we're a 24 7-day-a-week service, and we work from the cradle to the grave. And during this pandemic, our workers were going into families' homes for child protection matters and sort of having to work with families. So it was a difficult time on their own mental health. We were also faced with a lot of our members where a lot of the service users we deal with have their own issues. So ultimately, sort of trying to deal with that and trying to balance that in your own life was causing a lot of stress on our members. So it's ultimately sort of dealing with mental health issues was having a really impact on our members. So that's led, and I'm not surprised it's led to, I think it's 47% of social workers in the West Midlands highlighting that the present job is affecting their mental health, which is no real surprise to us.
No, I completely agree. I think it's having a worse effect on people on frontline jobs like that more than I think everyone's going to realise. And I think the demand for access to mental health is going to skyrocket once we really start to come out of this. So do you think there'll be a change of attitude towards social workers as we ease out of the pandemic, much like there may be for sort of other key workers like supermarket workers and carers and things like that?
Well, I think there might be a change a attitude, but really what we're calling on, we're calling what we've called an action 6-point action plan, and the first one we're addressing at the moment regarding PPE. So we need that for social workers to be respected. The second bit is that really this acknowledgement that social workers require the mental health support in their own profession, and also the third one is that again looking at employers, that employers must look at there's bound to be a surge in casework, because you think about the recent time, there's not been a lot of referrals to social work because schools have been closed, community centres, youth centres, adult centres. So once things start getting back to a so-called normal, social work departments are going to be overwhelmed with referrals. And also, because there's already a crisis in the recruitment of social work, we can't just fill that gap with agency staff, because that's going to be expensive for your local authorities in the West Midlands. And again, when we abandon the word austerity around, and apparently austerity is no longer an issue, but I think we all know the reality is that services will suffer, and that's going to have an impact on social workers doing the job. And finally, I think we're living in a changed environment now, and again, our last action is looking at a need to look at this online support, balance with a lot of our people we deal with. They don't have computers, they don't have access to to social media, and we're asking. At the moment, we've been asking a lot of people we work with to go online, and we've been conducting interviews over the phone or over the internet, and that's just not ideal.
No, sure. Going back to you were talking about how these things are going to be, these issues are going to be affecting the workers. It says that a third are potentially look for new jobs, because there's potentially a correlation between the issues that they've dealt with during this pandemic and them being deterred away from the profession. So in that sense, what needs to be done to avoid that and avoid this whole system kind of potentially collapsing in a way as demand is increasing?
Yeah, well, there's two answers to that. There's a short term and long term, and I won't name local authorities, but there's particular local authorities in West Midlands that are actually doing well. There's particular departments, and the reason why they're holding on to social workers is because they've invested in suitable teams, properly trained managers, properly resourced staff, and also making sure that caseloads are adequate. So the actual departments that have got it right, they're providing good well-being in workplace environments. What's going to happen is that if you don't put that in place, that you're going to continue to have a drain. So I guess in the short to medium term, we'll be asking employers to really look at how they're managing their social workers, and then in the short term, we'll be looking at government to reinvest back into social work services to fill that gap, and also to look at adequate funding for the very people we work with.
I don't suppose I know the Chancellor's been reeling off billions of pounds worth of money he's spending at the moment for various industries. What is there any sense of, as a union, do you know anything that any funding that is definitely going to be putting back into social work? Because I know there's loads for various sectors in the UK at the moment, but I haven't heard personally anything about social work.
No, we haven't either. And again, it's that's a complexity with social workers, because we're branded under this banner of social care. But the social care is such a huge remit, covering from anything from homes to centres to sort of daycare, that I think it's quite easy to say that social care has been adequately funded and there's more money. But ultimately, that money will not sort of come down to social work. We'll still be cutting back on our services, and that is a worrying time, because just what I said earlier, we expect our referrals to increase, and we anticipate that we won't have the staff to be able to fulfil these referrals. So somebody will lose out there.
I know. It's an extremely sort of concerning time. But how, as a union, will you be dealing with the fallout from this, and how will you be protecting your members?
Yeah, well, we have our dedicated advice and representation service, which is staffed all by social workers full time. And again, they have been really busy giving advice and representation. I've also been writing to a number of local authorities, just highlighting concerns and also suggestions that that they need to work on. We've also just produced a wellbeing and workplace toolkit for managers to use, and that's available to download for all social workers and managers, and that's looking at issues to do with well-being and mental health. So all these measures are achievable in the short term. We're also working on, at the moment, we're building up alliances with MPs in Parliament, and hoping to take that forward with sort of further questioning, and also making a reality that social workers need this further investment.
What do you think are the most important things that need to be done, either from local authorities or central government, to sort of bring maybe a slight reform or just improve the services and the landscape that the social workers conduct their duties in?
Yeah, it just goes back to initial points. It's about funding, investment, and making sure there's adequate resources. Ultimately, if you think of the austerity cutbacks, I mean, the very people that social workers work with, we used to be able to refer to specialist youth workers or children's workers or adult workers. All that services have been cut, so there's more of a demand on the services from social workers, and at the moment we just can't cope. So there's two answers to that. One, we'll be looking at to reintroduce funding into community measures to make sure that the very people who live in communities can have access to that. And the second measure is to make sure that social work teams are adequately funded and local authorities.
Sure, absolutely. John, they're all the questions that I've got for you. Is there anything else that you'd like to add at all?
No, that's everything. Thank you very much.
Thank you very much for talking to us. Really appreciate your time today. Good luck with all the great work that you're doing. I'm sure it's a tough time, but we'll get through all this.
Yeah, we will do. You look after yourself. Bye
all right,
now.
and you. Take care, John. Bye-bye.